If weakness suddenly affects one side of your body after 60, it may be a stroke warning and should never be ignored. A stroke can begin with a crooked smile, a weak arm, confused speech, sudden vision trouble, or loss of balance. These symptoms often appear suddenly, which is why recognizing the pattern quickly can change what happens next. The danger is not only missing the symptom, but waiting to see whether it improves before calling for emergency help. Even one sudden stroke warning sign can be enough to call 911 because treatment decisions are extremely time-sensitive. In this video, you will learn 6 major warning signs and exactly what to do if they appear in you or someone nearby. You are watching Dr. Edward, where we explain practical health information for adults over 60 in plain language. Today we will focus on recognizing stroke symptoms quickly without trying to diagnose the stroke type at home. This is general health education, and suspected stroke symptoms require immediate professional emergency assessment. A stroke happens when blood flow to part of the brain is blocked, or when a blood vessel in the brain suddenly bursts. Either event can injure brain tissue because affected cells lose the oxygen and nutrients carried by normal blood flow. That is why stroke can affect movement, speech, vision, balance, sensation, or other brain-controlled functions. Most warning signs begin suddenly, and the exact symptoms depend partly on which area of the brain is being affected. Warning sign number 1 is sudden facial weakness, drooping, or numbness, especially affecting one side of the face. Ask the person to smile and look for a new, uneven appearance, but do not use that simple check to rule stroke out. A normal-looking smile does not exclude stroke, because some strokes affect other functions without obvious face droop. Warning sign number 2 is sudden weakness or numbness in an arm or leg, especially affecting one side of the body. One arm may drift downward when both arms are raised, or a leg may suddenly feel weak, heavy, numb, or unreliable. Do not explain sudden one-sided weakness as simple fatigue until a stroke has been considered by emergency clinicians. Warning sign number 3 is sudden trouble speaking, understanding speech, choosing words, or making clear sentences. The person may sound slurred, use the wrong words, seem confused, or struggle to understand a simple spoken request. Do not assume unusual speech is caused by tiredness, alcohol, or age when the change appeared suddenly and unexpectedly. Warning sign number 4 is sudden trouble seeing, which may affect one eye, both eyes, or part of the visual field. Vision may suddenly become blurry, doubled, dim, or missing in one area, depending on the brain pathway involved. A sudden visual change can be easy to dismiss, especially without pain, but it still belongs among stroke warnings. Warning sign number 5 is sudden trouble walking, dizziness, loss of balance, or a new lack of coordination. The person may veer to one side, stumble unexpectedly, or suddenly become unable to stand or walk in a normal way. Dizziness alone has many possible causes, but sudden dizziness with other neurological changes raises greater concern. Warning sign number 6 is a sudden severe headache with no known cause, particularly when it is unusual for you. Headache is not present in every stroke, and a typical mild headache should not be treated as proof of a stroke. The important pattern is a sudden neurological change, especially when several warning signs appear at the same time. The American Stroke Association uses F.A.S.T to help people remember balance, eyes, face, arm, speech, and time. Balance means a sudden loss of balance or coordination, while eyes refers to a sudden change in normal vision. Face means new drooping or twisting. Arm means sudden weakness, and speech means sudden difficulty communicating. The final letter is time, because once a stroke warning appears, the response should be immediate rather than delayed. Stroke symptoms can sometimes fade after minutes, but disappearing symptoms do not mean the danger has passed. A brief episode may be a transient ischemic attack or TIA, which still needs urgent professional medical evaluation. Waiting for symptoms to return can waste critical time and may miss a chance to identify a serious vascular problem. Another mistake is trying to decide at home whether the problem is an ischemic stroke, a brain bleed, or something else. Those conditions can look similar at first, and brain imaging is often needed before clinicians know the stroke type. Do not give aspirin automatically for suspected stroke, because bleeding in the brain must be considered first. Do not offer food, drink, or pills if swallowing may be impaired, because a stroke can make swallowing unsafe. If the person collapses or becomes unresponsive, follow emergency dispatcher instructions while help is on the way. The central rule is simple. Sudden neurological symptoms deserve emergency action, not a wait-and-see experiment. Before I show you the action plan, subscribe and tap the bell for practical health guidance designed for adults over 60. If this information could help your family recognize a stroke faster, stay with me through the emergency steps. After the full plan, type 1 in the comments so I know you want more practical videos about emergency warning signs. Step 1 is to recognize the sudden change and avoid spending valuable minutes debating whether the symptom is serious. If even one classic stroke warning sign appears suddenly, call 911 in the United States rather than driving yourself. Emergency medical services can begin assessment on the way and alert the hospital that a possible stroke is arriving. Step 2 is to note the time when the symptoms first appeared or the last time the person was known to be normal. That timing can help the stroke team make treatment decisions, so write it down or remember it as accurately as you can. Step 3 is to keep the person safe, seated or lying down if needed, while waiting for emergency medical help. Do not let someone with new weakness, dizziness, or vision loss walk alone, because falling can add another injury. Step 4 is to gather useful medical information without delaying the emergency call or slowing the ambulance response. Bring a current medication list if possible, especially blood thinners, diabetes, drugs, and other important medicines. Also note major medical conditions, allergies, recent procedures, and when the person was last seen without symptoms. Step 5 is to watch for changes while waiting and report new weakness, confusion, vomiting, seizure, or fainting. Follow the emergency dispatcher's instructions instead of improvising treatment or searching online for a diagnosis. Step 6 is to avoid food or drink until swallowing safety is clear, because some strokes interfere with swallowing. Even water can be unsafe if swallowing is impaired, so comfort the person without encouraging them to eat or drink. Step 7 is to stay calm enough to communicate clearly, because emergency teams need simple and accurate information. Say which symptoms started, which side is affected, when they began, and whether they changed before help arrived. Do not minimize symptoms because the person feels embarrassed, wants to sleep, or insists that the problem will pass. Older adults may attribute weakness or confusion to fatigue, but sudden changes deserve a different level of concern. Family members should also avoid waiting for a second symptom before acting, because one warning sign can be enough. The same principle applies when symptoms disappear, because a TIA can look like stroke and still requires urgent care. Once at the hospital, clinicians may use brain imaging, blood tests, heart monitoring, and neurological examination. The goal is to determine whether a stroke occurred, what type it is, and which treatment is appropriate for that person. Treatment differs between blocked vessel and bleeding strokes, which is another reason home treatment is unsafe. Some ischemic strokes may receive clot-dissolving medicine when the patient meets specific timing and safety criteria. Certain large vessel ischemic strokes may also be treated with mechanical thrombectomy in carefully selected patients. Those options make rapid recognition important, but not every patient receives the same treatment or follows one path. Recovery also varies widely, depending on stroke location, severity, treatment timing, age, and overall medical health. Rehabilitation may involve physical therapy, occupational therapy, speech therapy, or other support after stabilization. Preventing another stroke becomes important after the emergency, but prevention is not the first task during symptoms. Blood pressure, atrial fibrillation, smoking, diabetes, cholesterol, and other risks can be addressed during follow-up. Do not delay calling 911 to check your blood pressure repeatedly, because a home reading cannot rule stroke in or out. Likewise, a normal blood pressure number does not make sudden face, arm, speech, vision, or balance symptoms safe. Some people experience stroke without dramatic pain, which is why painless weakness or speech trouble can be overlooked. Others may have symptoms during sleep and discover them on waking, making the last known well time especially important. If you live alone, keep your phone accessible and know how to contact emergency services if sudden symptoms begin. Family members can learn F.A.S.T together, so the response becomes automatic rather than uncertain during a crisis. One useful practice is identifying your address, medication list, emergency contacts, and major conditions in advance. This preparation does not prevent stroke, but it can reduce confusion when every minute suddenly feels more stressful. The key lesson is that stroke warnings are about sudden change, not about proving the diagnosis before asking for help. Face droop, one-sided weakness, speech trouble, vision change, balance loss, or severe headache deserve attention. Symptoms that improve quickly are not automatically safe, and a suspected TIA should not become a reason to stay home. Call 911 for suspected stroke in the United States, note the time, and let emergency professionals guide the next steps. Do not drive yourself. Do not wait for another symptom. And do not let temporary improvement convince you to ignore it. Fast action cannot guarantee recovery, but it gives the medical team the best opportunity to evaluate treatment options. Share this information with someone over 60, because recognizing a sudden change may help them respond without delay. Keep F.A.S.T simple in your mind. Balance, eyes, face, arm, speech, and time to call emergency services. If a warning sign appears, your job is not to diagnose the stroke. Your job is to recognize the change and act quickly. Subscribe for practical health education after 60 and call 911 immediately when stroke warning signs suddenly appear.